Hello everyone, welcome to Diagnose It. So today we are here with our new case. So let's discuss it. So we are presented with a patient who is having pain and paresthesia of the neck, shoulder region, arm or hand, and it is often bilateral. The patient is having difficulty with fine motor tasks of the hand. On the examination, it is revealed that it is a sensitive disorder. Muscle weaknesses are there. Muscle atrophy of the finger flexors are there. And on the palpation of the subclavicular area, there is presence of pain in the patient. And it is a neurological compression. So based on these symptoms or on examination, we can say that it is a case of thoracic outlet syndrome. Thoracic outlet syndrome. TOS. So as it is mentioned specifically that it is a neurological compression, so we can say that it is a neurologic TOS. Neurologic TOS. So now talking more about the thoracic outlet syndrome. So it is basically a non-specific diagnosis. It is a non-specific diagnosis which represents many conditions which involve the compression of the neurovascular structures which pass through the thoracic outlet. So talking about the basic anatomy. So the thoracic outlet is formed by the first rib, the clavicle bone, and the scalene muscles. The scalene muscles. The structures which pass through this triangle are neurovascular structures. The neurovascular structures. So these include the brachial plexus, the subclavian artery, and also the subclavian vein. So these are some of the structures which pass through it. So any increase in the pressure in the thoracic outlet leads to the compression of these structures which produce the mentioned symptoms. So this is the diagnosis of thoracic outlet syndrome. Now talking about the types of the thoracic outlet syndrome. So basically we have three types of thoracic outlet syndrome. First one is the neurogenic TOS, second one is the venous TOS, and the last one is the arterial TOS. The chances of neurogenic TOS are the maximum. It is present in almost 95% of the cases of thoracic outlet syndrome. They are neurogenic. The venous TOS is present in 5% of the cases, and arterial is very less. It is less than 1%. But the arterial thoracic outlet syndrome is the most severest form of this thoracic outlet syndrome. So what happens in the neurogenic TOS? It occurs due to the compression of brachial plexus. The nerves of the brachial plexus get compressed. So due to this, the neurogenic TOS occurs. So what can be the symptoms in this neurogenic TOS? It includes the numbness or tingling sensations in the hands and the fingers of upper limb. Then other symptoms can be pain and weakness in the arms and shoulder region. And then we also have muscle wasting in the hands. So these are some of the symptoms of neurogenic TOS, which is the most common condition. Then we have the venous thoracic outlet syndrome. It occurs due to the compression of subclavian vein. Subclavian vein compression. The symptoms might include that there can be swelling, there can be heaviness, there can be weakness, blueness of the arm and hand region. It also, we can see that in the patient, the veins are dilated and the upper extremity develops the deep venous thrombosis. The upper extremity develops deep venous thrombosis, also known as the DVTs, if this venous thoracic outlet syndrome persists for a long duration. So this is about the venous TOS, and now the most severest form, that is the arterial thoracic outlet syndrome. So it basically occurs due to the compression of the subclavian artery. So the symptoms it include that due to the lack of blood supply to the upper limb, or we can see that the upper extremity, there occurs the death of the tissues of the hand, and the pain, weakness, and paleness of the hands and finger are the common symptoms. So in this, basically the death of tissues occur. So these are the three types of the thoracic outlet syndrome. So the various risk factors for the development of thoracic outlet syndrome include, so first one is the abnormal anatomy. So it includes the cervical rib syndrome, scalene anticus syndrome, hyperabduction syndrome, and the costoclavicular syndrome. So in the first number is the cervical rib syndrome. So there can be presence of any extra cervical rib due to which the compression of the neurovascular structures take place. Then in the scalene anticus syndrome, there can be an abnormal scalene muscle which is causing the compression of the structures. And in the hyperabduction syndrome, in hyperabduction syndrome, the compression of structures occurs due to the pectoralis minor muscle, and in the costoclavicular syndrome, the compression occurs due to the clavicle bone, the costoclavicular syndrome. So these are the basic risk factors due to the abnormal anatomy. Then there can be any injury due to the trauma. due to which the compression of the structures take place. Then we have the carrying of heavy loads, overhead carrying of the heavy loads leads to the compression of the structures. Then the poor posture during the normal day-to-day activity and also during the sleeping phase. The hypertrophy of the muscles and obesities, hypertrophy and excessive bodybuilding might be the cause for the obstruction or the compression of the structures. Excessive bodybuilding, and also in the swimmers or baseball players or tennis players, as in these athletes, they are engaged in repetitive motions that involve the extreme abduction and extreme rotation of the involving the compression of the excessive stress develops on the thoracic outlet, due to which the compression of the structures take place. Now talking about the diagnosis part, so the diagnosis can be made on the basis of examining of the symptoms. Like some specific symptoms are present in the thoracic outlet syndrome, that is presence of numbness and tingling sensations in the upper limb. Then there can be the discoloration of the forearm and arm, the paleness or the dark bluish color. These can be due to the arterial or venous obstructions. So numbness and the discoloration. These are some of the symptoms on the examination of which we can say that it might be a case of the thoracic outlet syndrome, the discoloration. Then we have some of the physical tests which are quite helpful in the diagnosis. For example, we see for the posture of the patient, the improper posture can be a cause for the thoracic outlet syndrome. Then we can do the Edson's maneuver. Edson maneuver is basically for testing the arterial thoracic outlet syndrome. Then we can also do the Sperling's test. Sperling's test. So these are some of the physical tests which are very helpful in the diagnosis of thoracic outlet syndrome. Then we can do some electrodiagnostic studies and nerve conduction studies for the diagnosis of the most common neurogenic thoracic outlet syndrome. Then we can use various imaging techniques, for example, the PET scan, the CT scan, and but the ultrasound is not that much helpful. The venous Dopplers can be used for the diagnosis of the venous thoracic outlet syndrome. So these are some of the tests, or these are some of the ways which are quite helpful in the diagnosis of the thoracic outlet syndrome. Now, in the treatment part, so basically we have a conservative management and other surgical interventions which can be used for treating the thoracic outlet syndrome. So the conservative management is most commonly recommended by the physicians, recommended because of the prognosis is quite good, is prognosis very good in case of this conservative management. However, the surgical interventions are not recommended because of the non-specific and vague nature of the symptoms which are present in thoracic outlet syndrome. Many side effects are noticed during the surgical interventions. So in the conservative management we can have the first of all the lifestyle modifications which include the correction of posture both during the day-to-day activity and also during the sleep. Then we can prefer some of the physical therapies. These physical therapies basically aim at the strengthening of the muscles which are present around the thoracic outlet to relieve the pressure which is developing and it is leading to the compression of the structures. So also we can have the rehabilitation therapies. So these are some of the conservative management procedures which can be used for treating the thoracic outlet syndrome, and the prognosis is very good in case of the conservative management. So specifically in case of neurogenic tears, for relieving the patient from the pain and other side effects, we can provide him with the pain relievers and also the muscle relaxants. These are quite useful. And in the venous tears, we can give the patient with anticoagulants and the clot dissolvers due to the formation of the clots in the patient in the upper extremity due to the obstruction or the compression of the subclavian vein. Clot dissolvers we can give to relieve the patient from the symptoms. So this is all about the thoracic outlet syndrome. Thanks for watching, and don't forget to like, subscribe and share Diagnose It, and also do follow us on Instagram. Thank you.